that handout, okay, that's available for you. This is kind of cool because this looks at where's the thymus, some of them go to, and some of them in the bone marrow. You can see the bone marrow. So all of them are initiated in the bone marrow, like in here, your hip, where they usually take, when they're going to do bone marrow transplant on somebody, and they take the tissue from the donor to give to the person that has cancer. They'll take it a lot of times from the iliac crest, or the hip, one of the hip bones, because that's a big source of it. That's why when you have a fracture hip, you gotta be careful if it's, it's in the pelvis, not the hip, pelvis. So, if you have a fractured pelvis, you're very mindful of that because that's very vascular, and that can have that person really bleeding. If that person's on Eliquis or any other kind of anticoagulant therapy, you're in real trouble with hemorrhaging to that. Okay, so this is the appendix. This is Peyer's patches. This is inguinal lymph nodes. You know, your lymph system is a totally separate system than your circulatory system, and it's amazing. Okay, how it protects you from the germs in the world that you really sleep and everything. So we'll talk a little bit about the spleen and what that does, and axillary lymph nodes. The bronchus has there are particular things in the lungs that help with infection. Thymus, the tonsils, and the adenoids. And some of these, and in your appendix, some of these things they thought were not necessary at all, and now they're realizing there really was a reason why those happened. Okay? So that's not to take them out, and they don't need to be taken out. Okay? So you have the bone marrow, you have the lymphoblasts. Some go to the bone, they all start out in the bone marrow. Some go to the bone marrow to mature, and some go to the thymus to mature, and then that's the breakdown, okay? So that's how you get your antibodies and your humoral response in the bottom, and then that's how you get your cell-mediated response, okay? So that's a nice little chart. This is just one of those in all other book that I had talked about the types of immunity acquired, so you got your active, your antibodies are produced in the body in response to an antigen. That's long duration, okay? Let me just catch up. Oh, I did want to tell you the granulocytes include the neutrophils, the eosinophils, and the basophils. And as I said, the neutrophils are the first on site. But the eosinophils and basophils, those are elevated if it's an allergic reaction or a stress response, stress reactions. Just so you know. Okay. Okay, so acquired immunity is during lifelong, or if you get a disease, most of the time it's lifelong, and acquired during life, but it's not present at birth. Okay, that's acquired. Exposed to antigens through immunization or the disease itself, and those result in protective immune response. Two types of acquired immunity are active and passive. Let's see. Your book will give you a very in-depth explanation of acquired immunity and active and passive. Okay. So antibodies that are produced by the body. This is the one I have. Antibodies produced by the body in response to an antigen that's long duration. Antibodies formed in the presence of active infection in the body, like chickenpox or not so much flu, because it's not like one that keeps changing. So chickenpox, Hep B, things like that. Anyway, those would be lifelong. Antigens or toxoids are administered to stimulate antibody production. So those are artificial types. They may last for many years, and the immunity must be reinforced by a booster. Passive passive immunity would be antibodies that are produced by another source, animal or human, and that's short term. Okay? And natural will be antibodies transferred naturally from an immune mother to the baby through the placenta or the colostrum. And then artificial would be immunotherapy antibody from an animal or other human injected. That would be your gamma globulin, and those only last for 2 to 3 weeks. So example of that would be if you have a baby that's born to a mother with some disease, they might give them to treat it. So, and then they'll give like Hep B vaccine, and they'll give globulin, and then they'll give the Hep B vaccine, so that eventually that kicks in and you're not going to get it, okay? The mothers have to be positive at so what are you going to do first? You're going to do your nursing assessment. You're going to start out with the health history, right? And your nursing process. So you want to look at disease disorders. You need to know history. You want to know their age, very young, the immune system's immature, the elderly, the production and function of the T cells is starting to become impaired and decreased, so their ability to respond to invading organisms is diminished when they're people over 65. Okay? Nutrition, if it's good and balanced diet, and vitamins are very important, then people are going to be able to fight things off better, or at least do well during the disease and not have to use that. Immunizations and diseases of childhood. Recent immunization, you get the flu, you know, pneumococcal, you have Hep A, and degenerative PPD, that type of thing. You don't want to have PPDs too often. If you have PPDs too often, it can actually have you treated to a positive one. So once a year is pretty much the best way to look at it. Okay. Is that our air conditioning going on? Unless it must be on some kind of time. Okay. Allergies, food and drugs, and environmental. You want to know obviously you have their health histories. So what would be some diseases that might be a problem for you? So is there anything of like autoimmune disorders? What autoimmune disorder might hurt people in their ability to fight off disease? Rheumatoid arthritis is a high one, and psoriasis, because that's an autoimmune disease. And what about lupus? Lupus, okay? And lupus, rheumatoid arthritis, psoriasis, depends on the course of the disease and the treatments, okay? And then neoplastic disease. What's neoplastic disease again? Cancer. Yeah. So dates, course, treatments, screening tests, and family history. One of the things you always want to ask, one of the things you always want to ask before you give the chickenpox vaccine to anybody is ask if anybody in the family has cancer and is on chemotherapy and get immunosuppressed. Because they can die from being infected by chickenpox because your kid got a vaccine. Okay? And that could also mean a young child that has leukemia that's in their classroom. Okay? So you want to find that out. It's important to get all your immunizations because, as I said, if someone gets wild chickenpox, it's hysterical to call about chickenpox now. If someone gets chickenpox, and you're not vaccinated, and they get chickenpox, this is people who withhold vaccines from their children, the chickenpox vaccine from their children, because their child was fine. I've had so many mothers say to me, oh, my child doesn't need immunization because they're not getting any of those diseases because their immune system is much stronger because I haven't had to get vaccines. And I'm like, you're living because of the herd effect. Your child is healthy because of the herd effect. So tell me what the herd effect means. Everybody else around them has had the vaccinations protecting their child. How unfair is that? Now the thing is, if that child goes somewhere and gets a wild chickenpox, and goes back to school, and they got a little friend that just got back to school after having chemotherapy, leukemia, and they're just back in school and they get chickenpox because their immune system is crap because of leukemia. They're going to get, if they get leukemia, if they get chickenpox, that could kill them. I mean, seriously, could kill them. Okay? So that's just incredibly unfair that other people are taking the risk and they haven't. And there's a whole thing of it's a whole thing of gentle education to try to bring people on and have mothers and fathers who play the game of, well, I'm going to look it up. Thanks for the articles. I'll read them and I'll make an appointment at that and make a decision. And they'll do this for 10 years. And they'll not telling the truth. They're just, and what our practices are doing now, you got to practice will not get immunizations because they don't want them getting the kids in their office sick and they're waiting to be sick.
How long after a kid gets a chickenpox vaccine can they be contacted?
What you do, what I've always done is have the family, I would be happy to have a nurse visit for them to just come and get it. Once they talk to the oncologist, or, you know, and the oncologist makes that decision. As if it's safe for them to get it, or when should they wait till? Usually the first month is not be waiting.
But is it, like, if it's this, is it like a month later?
That I really don't know. Again, I would call the oncologist or the, what's the other name for someone that does chemotherapy? Hematologist, yes, absolutely, hematologist. So you could, actually, if you look that up, I'm giving a lecture on blood gases next Wednesday. And if you can find that answer, I'd love you to share it. If anybody else wants to look it up, that'd be great. I don't know the answer to that because I won't give it unless they talk to the physicians of the person that is at risk of the illness. I wouldn't order it to be given by the nurse. Okay. So the other thing you want is medications and blood transfusions they've had. Of course, there's still people around, there's a lot of people around that were around. What year was it if you got a blood transfusion before that year was a possibility of HIV?
80-something.
1985. Okay? So it went until 1985. Okay? And I can remember, I'm A positive and my kids were all I'm A negative and my kids were all A positive. So I had to get Rogaine with all my pregnancies, and I was nervous because it was blood product. And I asked those questions. I said, well, is that blood product at risk for getting HIV from this blood product? And because apparently it was heat treated, it was no risk. But I did ask that question. It was like, and I said, because I'd gotten it before, but then we got into 1985, and then, that was my second shot. So, okay, lifestyle and other factors. What did you say? They're as old as you. My kids are as old as you. Older than you guys, actually. Some of you. But I still think of them as little boys, so it doesn't matter. And I tried 3 times to the girl. So lifestyle and other factors, name some things. What would you be worried about that? Absolutely, high on the list, yes. Yeah. Drug use is the big one, the biggest one to get. Do you know, when I went to community hospital in Cape Cod, because I said, well, I'd see patients up to 25, no problem. But I still consider them, because a lot of times people are still in college, and so we keep them in practice until they finish college. There's no sense in having them switch to an adult practitioner when they were probably going to get a job and move somewhere and change again. So we just keep them for them until they finish graduating college, especially if they don't get the extreme medication, but no primary care provider in adult world, internal medicine world, we prescribe them that way. So we keep them if they need that to get through their college careers. And so I have patients from birth to 25. They started channeling all the drug users into my practice. And so I was treating people at 20 to 25 for substance abusers that were, and you had to find out what they were using, try to, hopefully they were being honest with you, but just in case they wouldn't get all the labs done. And we found out what they had and what was wrong with the treatment for it. And, one of them had Hep C. I had explained to them they had either Hep C or HIV or both. Okay? So that was really hard. So they have to go through that with the patients that we care about. So, anyway. So smoking, alcohol, diet, it's lousy or good, vitamin intake, and IV drug use, other things too. But they all affect the immune response, right? All that things. And then physical examination, you need good mucous membranes and good skin and mucous membranes, okay? So if they have any, assess them for lesions and inflammatory reactions, etc. So that'll worry about their ability to fight off infection. Diabetes, oh yeah. And they're not able to even handle an infection if they have like in the lower extremities. What often happens with people who are brittle diabetics, they're trouble amputated, and foot amputated, and then the whole knee amputated. It's really sad. What about what other systems in the body? Hypertension. What causes a lot of hypertension? Diet, what stress, but what organ is most affected by that? And what causes hypertension? Not so much the heart as the kidneys. The kidneys really affect hypertension. Okay, so diabetes, chronic illnesses, and surgeries that you see, any kind of abdominal surgery, diabetes, renal issues, and COPD. So the heart and the lungs. COPD is all black. Special problems would be burns. They're just, it's incredible how stressed people are with large burns. They really do not do well with that. And they have to be fluid resuscitated constantly until they get skin grafts or whatever. Sometimes it's not going to heal, and the skin will form if there's no skin there. You can't pull the sides of it together to heal, so you have to take, like Moses, skin grafts or whatever. Use skin grafts from cadavers and anything they can. So burns, physiological or psychological stress, because you have that cortisol disease. All of you are learning about the stress response, right? And if cortisol release and that suppresses the normal immune response. And if you're stressed out, you're releasing hormones in your body, cortisol, and it suppresses to try to calm you down. Well, it's calming down because it shouldn't calm down. Okay? So this is I already showed you that other slide. Okay, so this is diagnostic evaluation. I'll let you guys read that. Specific antigen antibody might be MMR. If you're not sure, they don't have proof of vaccination, you do a blood test to tell if they've been exposed and if they have immunity. So, okay? So that's what they do when you needed to get titers to prove that we had chicken pox, because we believe I got 65 titers, because there's no proof anywhere that I had measles, chicken pox, German measles, headache, So, anyway, so there's all your, what? That's because you didn't get a really good, this is the first time you have a light case.
Yeah.
And that's common. Did you know that? If you get a light case of chicken pox, you can get it again. And it's brutal if you're older and you get it. Apparently it's really uncomfortable. I had it when I was like little. Oh, we had the summer chicken pox in my house because they didn't have the chicken pox disease. They didn't have chicken pox vaccine then. And so one of my kids, the last day of kindergarten, my oldest child, was sitting next to somebody who came down with chickenpox the day after kindergarten ended. And she had the respiratory illness, prodromal symptoms. They had usually coughing, sneezing, and all that stuff. And sitting next to them on the bus because they were best friends and they were next to each other. And so she gave me chickenpox. But of course, when did you get chickenpox? How long was the incubation period? You don't know? It could be like 2 weeks, 21 days, okay?
Shingles too, right? I got shingles when my mom passed away, so I was so stressed out and I got shingles. And I was around my sister, who for some reason, I'm going to be chicken pox, and she got chicken pox.
Yes.
I had chicken pox.
Now, that's something that nursing students sometimes have a really hard time wrapping their heads around. If you're exposed to somebody with chickenpox and you don't have a chickenpox titer, or you didn't get the chickenpox vaccine, you can get chickenpox from the person with shingles. Does that make sense? You can't get shingles from the person with shingles. Shingles you just get to yourself because you're stressed. And it usually hides in the base of your spine, it's in your nerves, and it comes flaring up. The bad part is, as I said, it's on your face or on your face, and all the rest of it falls out. It's awful. It's so much pain. Did you do okay?
I just did a little patch on my back, and I only got it because I was vaccinated for chickenpox, but unfortunately, I was vaccinated and a few days later I was exposed by
chicken. So maybe it helped you a little bit, not a lot.
So I had, the virus living in my body, and like, you might get shingles one day, I just didn't expect
everybody know how to diagnose shingles? It's all in one side of the body, and it's the nerve endings on that side. Most common place is the trunk in here, and it looks like a blister. It looks like, not really quite like chickenpox, it's much more raised, clear, blisters. It looks like if you got a blister on your, and it bulges out this pool of clear fluid, that's what shingles looks like on your chest, and it's red, very itchy, very uncomfortable. And lidocaine, those lidocaine patches work to help the pain sometimes, but what you want to do is you want to get an antiviral medication right away, because that will at least make you a little more comfortable and it'll shorten the disease process, okay? So you do want to get them to go right away, call them up and say, do you know that little blistery looking rash? I was exposed to some shingles, and I got shingles. Or, no, I had chickenpox before, but see, if you had chickenpox, you can get shingles, which is why you get the shingles vaccine. If you've never had chickenpox, and you get the chickenpox vaccine, you don't have to worry, because you're not going to get shingles. But you're not going to get shingles. Okay, so that's the beauty of this vaccine, is nobody will get shingles if everybody is a child gets a chickenpox vaccine. Okay, where are we now? So, specific antibody antigen tests, you test to see if they have immunity, and we talked about IgG lets you know if you've been exposed and are immune. Okay, the IgG does that. Okay, so I'm giving you the chain, your old friend, the chain of infection. So how do you take people out of the chain of infection right away? How do you take them right away? Well, that's a real important thing to do. But if you've given them, if you're up to date on other organizations, you're taking them out of the chain of infection for all those things, right? So that's a beautiful thing to do to kids, okay? But just to remind you of the chain of infection, and, hand washings here, and all, just read through, you have that slide, you've seen it a million times, and it's it's nice and visual. I like this so much better than concept. Everybody's different. Everybody has a look and learn and study. I look at concept now and I just get so confused. I have to really think about it more again to get it feel together. Some people can just sort of think like that. I need visuals. Things are okay, so this is again the same thing that I showed you before. I just brought it up again. This is for acquired immunity. Now, this is an example of a very old immunization record. And the reason I put this up, so I put the one up that they had from 2004 or 2003, and it's probably already outdated and making changes, okay? What's really interesting is the IPV, the polio, you need 3, but if you get the last one at the first one at age 4, you don't need any more. Does that make sense? But most people get them right away, IPV early, like 2 months, 4 months, and then they get the third one, and they get a fourth one at 4. But if you have a kid that moves here from another country, and you're up in your organizations and they have never had a polio vaccine, if you give them one and they're 4 years old, or 5 years old, or 6 years old, they don't need any more. They don't need the 4 vaccines anymore. Okay? But it becomes outdated instantly. Okay? So that's the only reason I have that up there. It's just an example of the old one. Okay. So you can go into the CDC for, just go to cdc.gov and you can look at all this information. So what I have the most fun with, if anybody wants to do it during this class, you can, is you can go to cdc.gov and you look for travel vaccines. And you look at, we can just pick a country or two, and you can look up the country or two and see, is dengue virus going around, or, malaria prevalent there, and you need to start malaria. Now, what's one of the things you need to remember about malaria treatments? You have to start them when you get there, and you have to continue them for like a period of time after you get home. And then you can stop, because if you get bit by a mosquito the day you're leaving, and you stop your malaria medication. Sorry, let me shut this out. Okay,
are we going to need to know all the recommendations for the vaccines for testing?
No, I think that giving rabies vaccines to college-age students that are doing like an internship for the summer with, like forestry service or, up in like Maine or something, you know, and they're gonna be in, working with forest rangers, or they're doing some kind of an internship in the summer, and I'd have to have it there. There's only one family, one time I had to have a rabies vaccine given to a family. And it was the family, they brought the baby in, the kids in, the parents, all, and the dad came in. And what happened is, dad was babysitting, of course, it could have been the mom, it didn't matter, sometimes, yeah, anything bad about the dad. But he looked out, he's in the house, his two older kids were, you know, they were all young, they were all like under 9 or 10. He had the baby in the house with him, and the other two were playing out in the swings in the backyard. And he's keeping an eye on them through the window, and he looks out, and the family dog is out there, they're golden, they're lab or golden, and the dog's out there with them, and a coyote comes into the yard. And the family dog started to fight the coyote. And the coyote eventually left, so you can't get, the way you find out if an animal has rabies is you actually kill the animal, euthanize them, and test the brain. The brain is really going to find whether they have rabies or not. So you couldn't prove that the coyote did, and why did they come in the yard with kids and a dog? And that's not normal, they usually hide in the woods, okay? So that's not normal, that was the first thing that kind of piqued my concern. And it's my, Susie had me in clinical going and told her to go out fishing out, but anyway, having had 9 litters and I believe in children, to feel children with them, agility and all kinds of things, so I was going to share. Anyway, so, and all my kids own 2 dogs and my dog, they live in my house. So, what happened with this situation was the father comes in and they want to know what to do. And so I called, because of the scenario, I called the public health office in town, in Belmont. And they punted me so fast to the county people, they punted me to someone else, and then I got punted within like 10 minutes I was talking to someone in the city. Okay? So that was the one that was helping me make this decision. And I said, I can't prove, there's no way of knowing if that coyote had rabies. And the problem was, is the dad went out and got the kids in the house, and then they all were hugging the dog because he was fighting off the coyote. And what did the dog have around its neck and on its fur? Saliva from the coyote. And the father couldn't remember if he washed his hands when he came in the house before picking up the baby. He didn't remember doing it. He was so fast. I mean, you wouldn't too. So I had to write orders to get rabies vaccine delivered to our practice so that I or the nurses could give them their sets of rabies vaccine. And we had to give even the baby. Because what's the alternative? The alternative is death. If the coyote had rabies and it was suspicious, because why would it be in the yard with the 2 kids and, you know, playing on the swings with the dog, we had a big dog with them. So, yeah. So that's the only time I had to actually order that. I ordered rabies to give, but and in addition to the college students that were doing internships up in the woods.
What do they have to do with the dog? You just have to get vaccinated?
The dog was fine because the dog's rabies vaccine were up to date.
Oh.
The dog is no problem. You know? So then they checked and we got, I think they got a booster, because you do, if you get bit by anything, you're supposed to give your dog a booster. Okay? So then the dog was fine. The dog was like, I'm fine.
Is that the same vaccine that they give to dogs?
What'd you say?
Is it the same rabies vaccine they give to dogs?
I'm sure it's for humans. I mean, it's whatever. They must do something different because your DNA is different than a dog's. I don't know. That's a very good question. You can find that out too. I'm sorry, I haven't gone that far. I figured I was far as the CDC and not the way to choose the whole family. And I bring that story now. No, I had 15 years as a pediatric nurse practitioner with all kinds of stories. And people's perceptions of things, you stand here and explain things to you, you want to go like, really? Anyway, so, okay. Okay, So you can also go into a hyperlink, you can establish a hyperlink, I'm not gonna do it now, but it does, it checks down the column and screws everything up. So, but you can go into the CDC, they have wonderful resources, you can look everything up, and you can look up and get any printout you want on any school age, and you can get all the vaccination schedules if you need them, you can, whatever, it's wonderful. Sometimes you gotta kind of search a little bit and get into the right link, because it'll take you down the path, and that's not where you wanna go, you go back to the beginning stuff again. So, okay, so, all right, now we got, so diseases, yeah, so, diseases like diphtheria, tetanus, pertussis, that's on the prior, I talked about that on the CDC organization. H flu, type B, it's a bacterial disease, HIV causes meningitis, pneumococcal, pneumonia, it causes, that's what causes epiglottitis. So we have not seen, since we started getting the HIP vaccine. The HIP vaccine is wonderful in my role. I am so glad you'll never, hopefully never see it as a kid, hasn't been immunized. You'll hopefully never see epiglottitis. Because the kids, their epiglottis absolutely swells up like a big cherry and clamps down and will actually, they have to be trained, okay? Unless you can get them intubated quickly before the swelling gets that bad. And when you're putting them into looking them up, you're asking a question, you've got a kid that's doing that COPD tripod sitting and trying to just breathe because they've got their respiratory, their airway is getting smaller because the lungs is swelling in the way. No, they won't even take the energy to swallow. They'll just be drooling and tripod sitting. This little kid trying to breathe. And that's when they go to the OR and they get intubated, and hopefully get intubated and then it clamps down and then they have to turn it. So they go to the OR and that's what happens. Okay, so it's really scary, okay? It's fortunate. Usually they present in the ER because the kids are bad. Sometimes they come to the office, but I love the HIP vaccine. So the kids would have to be intubated, but their lungs are fine. And as long as you have them intubated, their airway is open, and you just have to give them time through the virus treatment, antibiotics, and give them time to get through the virus, you had to keep them intubated to keep their airway open so that they could breathe. But their lungs are fine, so they didn't even need oxygen. So they'd be sitting there with a trach tube in their nose, going down their nose and into their lungs. But what did you have to do? Because what are they going to do? They're going to pull it out. So you have these kids that are like 1, 2, 3, 4 years old, and you have to have them absolutely restrained with full hitch restraints on their arms, And sometimes humidity helps, but not really, because you have the airway open, So you were just mainly, it was basically a one-to-one. The nurse would have to stay there and make sure they didn't go through that for like 2 days, 3 days. And now we don't see that, so it's really nice and glad. Spend a lot of time in Children's Hospital night shifts doing watching those kids. Okay. Polio, pneumococcal disease, meningitis and pneumonia, MMR, varicella, Hep B, Hep A, all kinds of good stuff, okay? And then, here I am. So incidence has declined with the increase in immunizations. However, you see pockets that will go up because people will decide not to vaccinate. And then it'll be like a whole bunch of families that will talk to each other, and you see them in clusters. Or social media things are making people not vaccinate their kids in. So it's very, very weird. Further decrease with the use of antibiotics and antitoxins, and however, that's recently too. However, recently people are, it's kind of going the other way. Serious risk of losing the herd effect if parents resistance to immunize their children, and adult vaccine medical diseases not well addressed in primary care, and we already had that conversation in the beginning of this lecture, right? The adult vaccines are not addressed as fully as they should be at all. I'm the one who brings up, what do I need now? Oh, you don't need a shingles vaccine? Oh, we didn't know that. Why don't you have a sheet on that? Everything. Check that every single annual, 6 month, 4 month, 5 month, 4 month, 6 month. It's 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, and then, actually 15 months, and then they go to every year. That, every time that's checked immediately before they even walk in the door, you know you're gonna have to do that. So, we would do that. Okay. Okay, recent exposure to infectious agents, you wanna know that, like you knew why you had shingles, because, right, you developed chickenpox, because you were exposed to shingles. Prodromal symptoms, I want everybody to know what the word prodromal means, okay? You know why. That's a gimme. Immunization history of having the disease. The prodromal phase is before you get the disease, you have these like non-specific symptoms, and they can't identify yet what they have, like they haven't broken out in pox yet, but they've got the coughing, sneezing, it looks like they're just coming down with a cold, but then boom, the pox is out the next day. So then that's chickenpox. The prodromal phase is talking about the incubation phase, may be long depending on the different diseases. And every single communicable disease has a specific range of incubation period. Okay. So primary prevention is the immunizations, control the spread, reduce cross-transmission of organisms. Good luck doing that with kids in school where they don't wash their hands and have little petri dishes when they come home and they give them to the older generation rather than their parents. You know, their grandparents will get sick first. Or their babysitters. Infection control policies and hand washing. You can't say it enough. So it was really funny. We really started in one point. It seemed to be increasing infections, and so we started letting our patients know, and also letting the school nurses know, putting plans in place to have the kids when they come in from lunch, when they come back from recesses, they should wash their hands, okay? And so they started doing that, and we had dramatically drop in some of the illnesses versus other towns around us. But I don't know if they still do it, and if other towns do it, or what it is now, because I'm not in that field. The other thing is, so something came to my head. Okay. Sharing drinks, that's it. So one of the, so funny, people go, well, why do I have to get a Hep B vaccine? Again, you know, going off to college, kids are going around there. People in senior in high school getting a Hep B vaccine because they're going off to college. Because freshman year in college, when everybody shares the mugs, you know, the straws and drinks and everything else. And just think about it, even the Epstein, mono. My hearing my grandmother cry because I got the kissing disease when I was in high school. Anyway, yeah, mono. I had mono. Anyway, but when you have, it's the Epstein-Barr virus, you can share that, you shed that for 3 months, easy, when you have mono. You shed it after you're all better back at school. So you gotta be really careful not to share drinks or kiss anybody. So there you go. Control spread disease to others, reduce risk of cross-contamination of cross-transmission organisms, infection control policies, and hand washing, as I said. Okay, so we got, next page. And also you all know that the alcohol-based washing with your hands with the alcohol base is just as good as washing your hands, because you usually will do that until your hands are dry because you're not going to touch them with wet, slimy hands from the hand sanitizer. But you may not spend the happy birthday to you time washing your hands out with water. The only times that you have to wash your hands obviously is bodily fluids, what? Neurovirus. Oh yeah. I mean a C. diff, absolutely C. diff, and some other ones. If you're in a precaution room, there are terror precautions, or you're in a serious precaution room, I would just always go. I would do the hand sanitizer on the way to the sink to wash your hands. Make sure we see the whole thing. Okay? So now we'll go get into some kids stuff. Good standard precautions, please, always. Dad's going to protect yourself and keep your career going, because if you're not careful, you're going to wind up getting sick and have a problem. Okay? And you don't want to do that. So normal phase is the incubation period to the early stages. And it's the early symptoms of this. You actually have the incubation period, then you have a prodromal. If they're starting to get sick, but you don't know quite what it is yet. Okay? All right. So, and this is something interesting you should all write down, actually, if anybody has something to write on or something to type in. There's diseases that they seriously look at for people that are either becoming pregnant or are pregnant. Okay? They call them the torch infections, T-O-R-C-H. Okay? So you write the T-O-R-C-H. And T is for toxoplasmosis. And that's what you can get from cats if you clean the litter box. So you don't ever want to do that if you're childbearing age and as a woman. You always have to delegate that to dad. The cat's dad. Okay? Or someone else who's pregnant. The O is other, and they add all the new ones that they have had since they put the torch thing in, so I'll name those later. But the R is rubella, and rubella is the German measles, right? And what's the problem with German measles if you're pregnant, if you get German measles when you're pregnant? What happens to the baby?
They die, right?
They can, but they usually also have they're blind. It's because of German measles that we had all kinds of, I don't know if you remember this, probably you don't. There used to be, in regional areas, Perkins School for the Blind. Okay? It used to be all over the place. Because there was no immunization for it, and people would get German measles, didn't know they had it because people were blind. Usually it also had some developmental delays, or they had, they were mentally impaired in some way. Often they were, had issues. Sometimes they were just blind. And so rubella is the R. And that's why they really push to make sure everybody's had the rubella vaccine if they're anticipating getting pregnant. Yes? It's on the next slide down. It's on the next slide down. Okay. I'm sorry. Okay. Yep, thank you. Okay, but I have my thing on the other one to torch. Okay, so I'm finishing that. The C is cytomegalovirus. 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 Okay? And the H is herpes simplex. Okay? Now the other is all of those. We'll put you have that. See, I don't have that slide in here because I stuck it in for you, but I didn't put it in my PowerPoint. Okay? So that's the other right now, but now you probably got COVID in there, and you got probably what's the thing they get on ships? Norovirus, yeah. So that probably would be an other. Okay, but there's your three. But the things that are at risk, I don't know what norovirus does to you if you're pregnant and you get it. Okay, but I know these are bad if you're pregnant. Okay. All right, so contraindications for vaccinations are allergy to the vaccination, particularly anaphylaxis to the vaccination, encephalopathy within 7 days of DTaP, it's diphtheria, tetanus, and attenuated pertussis, high fever or moderate to severe reaction, or seizures in 2 to 3 days after getting the vaccine. That's when you would need contraindications to that particular vaccine. Now, one of the things, they used to give the Tdap to just babies, and then when you get older, you used to just get a tetanus shot every 10 years. Does everybody remember that? Anybody remember that? You didn't get a Tdap, you got a tetanus shot, right? A TD, big T, little D. But they realized that the high school age kids were the ones babysitting the newborns, and the newborns were they have outbreaks of pertussis in high schools, and those kids were giving them to the babies. So that's why anybody that's going to be around a baby, because if a baby gets pertussis, it's an ICU admission, because they cannot catch their breath. They can't. They're coughing, and you have to intubate them sometimes. So,
If vaccine, you're pregnant for that, so the baby gets.
and that's great, because they also want everybody around you to be, like the grandparents. I mean, I have to get because of pediatrics, I have to get my Tdap anyway, every 4 or 5 years. And I just do that because it has to be within 5 years. And I I keep having grandchildren, so I have to keep doing that too. I'm not ready. And, okay, so we got, live vaccines are not indicated for patients, with those in contact, what's the name, MMR variants, those are your live vaccines. The live vaccines are not indicated for patients with, or those in contact with patients who are immunosuppressed, like, and I already explained that. So MMR and Varivax, you want to be concerned if someone's immunosuppressed around your child that's getting those vaccines or so they're immunosuppressed, they have HIV, they're on chemo, they have cancer, like especially like leukemia, or they're on chronic steroid use. So that might be somebody with COPD. So you want to think about that. Think about all these things, okay? So do not give MMR to pregnant women, okay? They do not give the MMR. Or the Varivax vaccines because it's a live virus. You don't get those to pregnant people. Also do not give Varivax to immunosuppressed or exposed to the patients have blood products in the past 6 months. So anticipatory guidance, have everybody heard that term, anticipatory guidance? It's something you hear in PD all the time. I don't think I've said it enough this semester. I usually push it on people. You want to know that close contact with cancer or chemo patient or receiving steroids or their HIV, that they get no Varivax, unless they talk to the hematologist or the oncologist to see if that's okay. All right? The other one is, okay, so the top one is caution is viremia with varicella zoster. Okay, this is Fifth's disease, it's called. It's erythema infectiosum. It's caused by human parvovirus. And that's in a Ricky book, we'll talk about it. Do you have the 4th edition in Ricky? The 4th or the 5th edition? 4th edition, I think. Yeah. Does anybody know offhand? Okay. If it's the 4th edition, it's on page 1310. Okay. So this is your stages of rash in the 3 stages. And the kids actually look like someone slapped them on the cheek. It's called slapped face appearance appears 1 to 4 days. Maculopapular rash and extremities last 7 days or more. The rash usually subsides, and the minute they let the kid out to go play and they run around outside and they get sweaty, their rash comes flying back. So you just keep them up a little bit calmer and cooler for a little while. There's a funny thing is they're acting fine, then they have the fever, and then the fever, oh, that's, excuse me, that's the next one, sorry. Okay. It's also an issue, the erythema Fifth's disease is also very much an issue with pregnant women. So if you got like a kindergarten teacher that's pregnant and a kid with Fifth's disease, that's not a good thing. Okay? So it may result in serious complications, may result in fetal death in the 2nd trimester. It's seasonal and often seen in private practice. Okay? So you want to be careful of that. Stay away from little kids. Especially roseola. That one, the kids are acting absolutely fine, even though they've got this fever that's like 102 or whatever. You think they'd be miserable and they're running around playing, they're acting absolutely fine, and then wham, they start with this rash comes out after a couple of days. Okay? So roseola is human herpes virus type 6. Incubation is 5 to 15 days. Persistent high fever for 3 to 4 days. Otherwise, they're fine. And then after the fever subsides, the rash appears. And the rash first is on the trunk, then the face, and then the extremities. It has a pattern that follows. Like measles has a pattern that follows too. So you can always tell by the rash what's. You can look it up and figure out what the disease is. So we got roseola. Excuse me, roseola. I just talked about. I'm sorry. That's the one that they're running around acting absolutely normal. They got a high fever, and they once the fever subsides, they get the rash. Rubeola, that is measles, regular measles, okay? And that's viral. Again, all the scary stuff's viral. The infection stuff you can treat, so it's not scary. You know, it can be scary once you get treated. So that's the one that can cause rash, meningitis, blindness, deafness. And World Health Organization says at least 900,000 deaths worldwide for children less than 5 years old related to measles every year. Okay? period 10 to 20 days, communicability is from 4 days before to 5 days after the appearance of the rash. If they have the rash relief, they're not contagious anymore. Topic spots, there's pictures of that in the book, in the good photo, you can look at that, okay? They appear 2 days before the rash starts, and it's individual. They look like tiny grains of white sand surrounded by red rings, okay? And little white pearl-like vesicles inside of the mouth. Mumps, that the only time you have to worry about that is a male, they get orchitis, O-R-C-H-I-T-I-S, that's in their testicles as well. The inflammation of it because, and they can become sterile. I think they only, if I read something recently, I think they only become sterile if they're already pubertal, but I'm not 100% sure. Sometimes if you give parents that won't give the mumps that's MMR, you can get them to give it to the boys. So that's an important thing. So that will protect. Okay? So that's transmitted via droplet and direct contact. It's part of exovirus, okay? And its incubation period is 14 to 21 days. Fever, headache, malaise, followed by parotitis. What's parotitis? Does anybody know? Parotid glands, yeah, so they get, who else gets parotitis? Who gets the inflammation of parotid glands? People that have anorexia and they do a lot of vomiting. Because if they do a lot of vomiting, they're irritating the parotid glands, and so sometimes you see these models that'll have these like great jaws, and what it is, if you look closely, actually, it's more they probably have parotitis because they don't eat disorder. And then the other thing here, I have people with beautiful big eyes, and they usually have their thyroid problems. And you'll start looking and saying, oh, you're not that pretty anymore. I used to think they were pretty, but they're not, now I'm really sick. So, anyway. So you can, I'm sad in your nurse, you just, the world changes a lot. And the other thing is, I must have a word across my forehead that says nurse on it. So I had people there working, there was a carpenter, and he had a sidekick that was with them. And somebody comes up and telling me he has problems and he needs to, what should you do for him when he has hemorrhoids? And I'm like, I said, and so I wrote down the community health center Cape Cod number and gave it to him. You can see. So I'm not going there. So it's just so funny. I mean, you will get all kinds of great questions. And I finally realized that I was like, why does he even know I'm a nurse? And then I realized that the guy who was lining them up to do the work has done painting for me, and he's painted like 6 rooms in my house this past winter. And he's very nice, lovely man from Jamaica who calls me nurse. Calls me nurse. I don't have a name. But he's very, very nice. And I get it to his care. So, okay, it's good. Okay, so anything else here? We talked about that. Oh, and also we cause meningitis up away. All right. Pertussis, that's the whooping cough. That's the kids that they'll keep talking, nothing left, and they go, and it's like a whoop. It's a sound like that. It's unlike no other evening. Droplet direct contact patient period 6 to 20. Rapid cough follows. If it's an infant, it's someone like less than 6 months old, they're going to be in the ICU. When I was at Children's Hospital, it was a brand new grad. I was working on an infant child medical unit, and I had an infant that had pertussis, and I would keep an eye on that infant. And I was in full precautions with droplets, gown mask, face shield, everything. And the kid got better the baby got better on my shift. And the baby was a baby of gypsies. And when you're a baby of gypsies, when they come to visit, it's not like when you're people, it's like a boy. They come to visit because the whole gypsy tribe comes to visit the baby. And so the baby got pretty better on my shift. And then 2 days later, this big box appeared as a present for me because the baby got better on my shift. And I'm like, so we opened it up, and it was all like, because in those days you didn't wear white stockings, you white support stockings, there was a whole box full of white support stockings. And I was like, what truck did they take? So I just left it there, and anybody that's my big pertussis story, okay,
When I
that's,
was in high school, they were, I think it was the 9th or 10th grade, they were not in school.
yeah. And those are the kids taking care of babysitting babies, right? So that's why now you get a DTaP booster in like 7th grade. And then then, 5 years later, if you're gonna be exposed to a baby, you know, you have to have money. So I think I'm really fine. So I actually keep a record of it, so I make sure that I'm getting basic. All right, what's next? So rubella, that's the German measles, and that's the scary one, direct or indirect contact. What time is it? It's time for a break? What time is it? Okay, you wanna take a break? You're saying no?
Yeah.
Okay, how many people want to take a break? Raise your hands. Okay, and we are going to go down. All right. Okay. Want to make it quick, because I've never seen so. Yeah, 10 minutes. But you've got my file, this is my phone. It's direct contact with something that's freshly, like it says, with an article that's freshly contaminated. It has to be freshly contaminated with manufacturing secretions, blood, urine, stool. And either orifice can pass it, I think that either orifice can pass it on. Incubation 14 to 21 days, and complications are rare. Greatest danger is teratogenic effect on the fetus, okay? And that one is the one that's only dangerous to pregnant women, if they're unvaccinated, and no prior history of disease, and they're not immune to it, so then they can have spontaneous abortion, blindness of the child, deafness, and 20,000 infants affected annually prior to the vaccine, so you don't have that. That's why you have, and the beauty of that vaccine is you have all these Perkins Home for the Blind schools closing, because you don't have as many, but they were wonderful resources for people because they, these kids would learn Braille and learn, everything. Deafness also is an issue. Did anybody ever read, or did I tell you guys about there was a person that came from Kent, England, that came to Plymouth, in the, 14, 15, whatever century, and came to, Plymouth Plantation, didn't like how they were doing religion there, so they moved to Sandwich, and then they moved to, they didn't like how they were doing religion, and they moved and started their own colony on Martha's Vineyard. And this person brought with him congenital deafness. And his family had it, and they all intermarried, and a lot of people on the vineyard for a couple hundred years were congenitally deaf. Okay? And everybody on the island learned how to speak the sign language. They all spoke sign. And what would happen was, the last person that had congenital deafness died in like 1970 something or whatever. So, but I'm talking when it first became a very popular place to go to vacation, when people were tourists in the like the general store or whatever, they'd switch to sign language and they'd all be laughing hysterically and making fun of the tourists, So they could talk to the tourists and know what they were talking about. But the kids that were deaf were sent to Taunton to this specific school. And the kids that weren't deaf and were healthy and no problems, they had to go to work on the farm. So they were lucky if they got a grade 2. As soon as they learned how to read and do numbers, they were on the farm working. And so the people that were deaf were much more highly educated, and all the women wanted to marry the guys that were deaf guys because they were the ship's merchants and captains, and they ran the business. So they had, it's just really, really funny. There's a book called Everyone There Spoke Sign. It's a wonderful book, story about the congenital deafness and Martha's Vineyard and history of it. If anybody's interested in ever reading it, some are like reading it, really fun. I read it when I was fascinated. But everybody spoke sign because they had so many family members, they all learned it. And so the store owners, everybody, when someone would come in and be deaf, would speak sign. So, anyway. And a lot of they developed American Sign Language. A lot of it came from the people from Martha's Vineyard. So I think it's really cool. I had one of my students did one of their papers on it, and wanted me to read the book. And I think he took the book and read the sense. But you can get it online. Get it on Amazon. It's paperback. Okay, so that's enough about German measles and deafness. Scarlet fever. So now, when you have strep throat, people do get over it and get most people get over it, they recuperate from it, they recover from it. Why do we treat them with antibiotics? Why do we jump on it so quickly to treat them with antibiotics? Because it's wicked, contagious, so they're going to pass it to other people. And if you don't take care of it in your own body, what can it cause? Scarlet fever. And can cause glomerulonephritis, which attacks the kidneys. So that's why, it's only like 1% or something risk of that happening, but it's high enough that you just treat it. It's easy. And you can treat it with cheap, just PenDK. PenDK is real cheap, it's generic. You've got a course of that. And everybody knows if you have strep, what do you throw away after you've been on the antibiotics for 24 hours? Please go on. And wash all the towels and washcloths and everything, and the hand towels in the kitchen, and use paper towels for a while, for like a few days, until they're finally immune. And yeah, so and change. If anybody's toothbrush is touching them, let's change them all. Just how cheap is that? Yeah. Well, you can scrub them with hot water yourself if you want to. Probably.
But it's not that that was the carrier by all of us.
This is your sister? Yeah. Some people, they blame the dog, and I'm sure, And what happens is, people will keep getting it, and getting it, and getting it. Feeling your sister probably was the one who didn't get it, and that should have piqued their interest. Is that really true? Yeah. It's an interesting disease. Not one of So, okay, so this is when you get group A hemolytic spread, transmissions, droplet direct contact, intubation 1 to 7 days, complications if you get issues is carditis. So that is, wasn't it one of the woman who wrote, the person who wrote Little Women, didn't her sister have scarlet fever, and that's why she had heart problems, and that's why she died young? Anyone's ever read Little Women or seen the movie? No? Okay. Incubation period 1 to 7 days, complications, as I said, and peritonsillar abscess. I talked about that before. That you get trismus, they cannot put in the mouth. When the kid comes in with that into primary care, you hook them up with an ENT person right away. Because that means they've got around their tonsil, they've got a big abscess. And if that bursts, they could aspirate. Very gross stuff in their lungs. And then they're in the hospital. So I was able to just put the tongue depressor in the teeth and get a lighted and saw something was the size of a brick. And I called the ENT. They didn't believe me because I was a nurse practitioner, so I called a different one and said, okay, right away, and said, yes, it's good, you put your something. Because they had to actually take the kid to the OR, put them under anesthesia, and lancet and aspirate it. Okay? So, peritonsillar abscess and glomerulonephritis, as I said, that they attacks the kidneys, so you want to be very careful. It's only a very small percentage that will do that, but it's enough that you just treat it. And as I said, PenDK is a really cheap drug, and it targets it. You don't need to have a broad spectrum to kill all the gut flora and everything else. That really does a good job. This is the rash and how it progresses, so you can look at that. Okay. When you feel the child's stomach, has anybody ever done work on sailboats and use like a fine to dry sandpaper? Very, very fine sandpaper. That's exactly what this one is doing. It's a little bit sandpaper. So pick it up right away. Conjunctivitis. When you see somebody with conjunctivitis, you always look at the ear on that same side because they go together. Everything's just close together. They often have an ear infection, so you want to check that too. Now they come in with conjunctivitis and you don't want that treated. That's viral. You treat it, it goes very pretty quickly with eye drops or eye ointment, like erythromycin, eye ointment, ilotycin eye ointment, and then the children will treat check with you. Okay? And it's probably viral anyway, but you check it because in case it gets worse than you treat, then they just call and say it's much worse than the child's living in crying, and then you call them a prescription like that. Infants like, tear duct obstruction, that's, their lacrimal duct gets clogged, you know, what's nice is you have, your, lacrimal your glands secrete, when they secrete your tears, they have, it's like antibiotics almost in the tears, that's why your eyes don't get affected all the time when you're exposed to things constantly. Okay, the tear duct is, I'm blanking on the name of it, dacryostenosis, okay? They have dacryostenosis, they will get that, probed if it continues to 6 months. If it continues to a year, they wanna probe it before they turn 12 months because they figure they can do it without general anesthesia at that point. When they're older, they'll fight harder, and so they usually anesthetize them to do it, so that's why they address it usually as well by, like say, 10 months, 11 months, so they're planning to try to do it. And one of my kids he was 99 pounds, doubled his weight in 6 months, so you can imagine 12 months how much he weighed. I don't know who was sweatier than a child, but they mummified him, did the probing at 11 months old, before he hit that 12-month period, or the ear, nose, and throat inspection. He came out and said, I didn't know he was that strong, I would have sent him to the answer, he would have been anesthetized if I realized that. So it was really fun. It was done, and it was fun. So, okay, so there are some websites, it's keepkidshealthy.com. I'm sure there's other ones. I don't like .coms. I like .orgs and .govs and .edu is better. And if you're going to use any paper, don't use .com reference for any paper you're writing, okay? Use .edu, .gov, or .gov. But it's kind of fun to use, and it's in the layman's language for you to share with patients and stuff like that. Okay, these are emerging infectious diseases that, conjunctivitis. All of you, a lot of you, I'm sure, when you went through maternity, you knew when you learned that the babies get, they'll put out a Tyson and they'll be ointment right away, so that in case they got chlamydia, gonorrhea, and herpes simplex, you know, if they get exposed, if the mother has an active herpes lesion in her vagina and she delivers the baby, they're at serious risk of developing herpes encephalitis. And I know this because I took care of 2 kids in the ICU at Children's Hospital, 2 babies, they were 2 weeks old, came in with herpes encephalitis at the same time, as long as a year after the other. And basically all you're doing is you're just keeping their on the ventilator, intubated, and keeping them alive until you finish giving them the negative EEGs in journal. I've done that, and I've taken care of patients that they call them near drowning, and some, they're either 5 hours later, they're sitting up eating peanut butter and jelly sandwich and they're extubated, or you've got to do the EEGs and sadly, that's what some of my life was at Children's Hospital in the ICU, anyway, but it was, I just learned so much, and I learned so much about people and compassion and everything else. So, anyway, okay, so guys, enough on that. It's usually bacterial, so it's usually viral, that can be bacterial. And 1 year, I went through my son's maternity, and I wanted like 3 prescriptions for him and just share it. I don't know what it was, I just wanted to do it. So, okay. And we talked about that. These are emerging things, or some that are now established. The problem is these old diseases that existed are becoming emerging to be global because we're so transportable now, and it's such a we're on movable populations as opposed to people staying in one place. H1N1 was considered it was a World Health Organization issued a global warning for the H5N1. That was the SARS virus, and that was not because they listed it as a pandemic, not because it was really, really bad disease to get. And H1N1 wasn't that bad either, but it spread so fast globally, it scared the hell out of us. And we knew that this was going to happen there, because one person leaves Mexico with this and goes here and then spreads all over that state. And when those people go visit friends, not knowing they were exposed and spread, it's unbelievable how it just spreads all over the world. And you know how fast, you saw how fast COVID spread all over the world. We can't contain it because we're too vulnerable. If people stay in their homes, they don't. go away, it's still in certain areas of the world. And that's something that causes microcephaly or some kind of brain development issues with babies. The real risk is the pregnant women. If a woman has it, she's supposed to wait X number of cycles before she tries to get pregnant if she's had Zika virus, and you want to make sure you culture negative. But if a man gets it, I think they used to say it lasted 6 months in the sperm, but I don't think it's that long anymore. I think they did some more studies. That's something I would look at if it ever, and I think it's actually in the Riki book, Zika virus, if you want to look it up, and you can also get information on the CDC. Okay? And that would probably be more accurate because the book's already just like a year old, and that's new stuff. So, West Nile virus, Legionnaire's disease, Lyme disease, MRSA, VRE, hantavirus, Ebola, Marburg viruses. We've all heard of those, and you can read about them here. You can also add to it, let's see. Certain ones have horrible mortality rates. The West Nile virus in the 1930s in Africa, U.S. in 1999, usually flu-like headache and fever, less than 1%. They'll have severe meningitis, okay? Legionnaire's disease is a pneumonia, gram-negative bacteria, real made history in 1976. Lyme disease, you know all about that, and they did develop a live vaccine, and it was 2 immunizations to get it, and the company that made it stopped producing it because nobody's getting it because they thought they would get Lyme disease from getting a vaccine. And I had the Lyme disease vaccine, and I'm the only one in my neighborhood who hasn't this. My great husband and I had a Lyme, we were down at the ER, we were down the hospital ER, we got 2 shots, and neither of us ever had Lyme disease, and all our neighbors around periodically would get hit by a tick, you know, Lyme disease, overdose, all our neighbors were right next to each woods. So, anyway, I go boldly into the, woods with my dogs and shorts, because I didn't have to worry about it. Anyway, so, hantavirus is 50% mortality, severe cardiopulmonary disease, it's rodent-carried virus, Ebola and Marburg virus are filovirus. 20 outbreaks since the 1960s, one was just not even like 5 years ago or so, and it was very scary. Both had prepared us for viral so here. And then H1N1 swine flu, that's that's serious. That was serious too. And then Zika virus, I read about Zika virus. Maybe I'll ask you a question about Zika virus. Because that's still around. And what was happening is you had people that were deployed to the Middle East or wherever, or South America or whatever, and they were deployed and then they'd come home, and when they would come home, they got the virus and gave it to people around. So, okay. Emerging infectious disease, we've got more of them. So again, you go, if you go, there's a great website for Massachusetts, these are the factories. Flu-like illness presenting with fever and cough. This was World Health Organization issued a global warning, and then you should keep going. So just, and then it goes to COVID-19, which nobody will ever forget. H1N1 was interesting because that one had very specific guidelines about when you could come back to work, and so they were short on nurses a lot because you had people that got it, and they had to stay out, even though they were well, they had to stay out all the protocols. So, okay, so travel immunization, you can go into the CDC website if you're planning on going somewhere like you looked up Ghana, okay? And then you can find out everything that's going on and whether you need to worry about malaria, mosquitoes, and all kinds of interesting things. Okay, and then there's just travel immunizations. You can go into these things, to these websites, and look up something. If you had time, like go into one of them, you can pick a country we're going to on vacation, and you can find out what kind of immunizations we're doing. That's what you can do. Diarrheal diseases, there's the whole list of them, okay? And that's kills 4 million people a year in developing countries with diarrheal diseases. U.S. about 400 children per year die from dehydration. Main factor for mortality and morbidity. The portal is always in oil ingestion and infected foods, and the stomach usually detects you with the high acid, but it decreases increased gastric acidity, or it's disrupted, the normal bowel flora is disrupted, like people take too many Tums, or people take Pepsid AC, or it disrupts your bowel flora, and a lot of antibiotics will do that. Or after surgery, or if you have AIDS, you'll be more susceptible to diarrheal diseases. Sexually transmitted diseases, HIV, AIDS, syphilis, gonorrhea, chlamydia, and cytomegalovirus, and I would also put in there HPV, the most commonly reported STIs, STDs. They changed it from STDs, sexually transmitted diseases, to STIs just a bit. They probably had a committee they put together and they had to earn their keep, and so they just changed it from that. This became relevant to study. So, I love when they change things after like 100 years of other things. Continue, you got your hepatitis B, HPV, your HCV. It's all the way up to F, guys. You got hepatitis F now, and probably even more. So just, so hepatitis is serious. So syphilis, I used to, people years ago used to not think about it. They kiss their child, they call it a syphilis. I think I said this to you guys before. They call it a syphilis, but they didn't know. And now it's like, the first time they get it, break out with a cold sore or herpes simplex virus, they're really, really sick. And really, we have pictures of kids with all the mouths all broken out and crusty. It's like almost like impetigo on there. There's this crusty, oozing, it's all there. HPV, K-Fluid, venereal ulcers, and Zika virus. So you might, I probably put something in Zika. Okay, this is to go to the website from Massachusetts, where they'll have the current treatment for any STDs or STIs. Home-based infection care of infectious disease. You're going to teach them how to be enforced. You're going to teach them all the things you know how to do so they don't pass on things to other people. And they don't make the patient a care until they get sick. Because they're out in public and they're being drugs home. And it's an old book, but it's scary as hell. And it's nonfiction. And it's all about following different